medical student at the City University of New York School of Medicine. I hail from Queens, New York, and I am the DEI coordinator for AWS.
Yeah, and I'm Maria. I'm a medical student at the University of North Carolina in Chapel Hill, and I'm a third-year medical student. So, and I'm the associate co-coordinator of the diversity and inclusion of the AWS. And so, as a brief introduction to our series, we interview women surgeons from ethnically diverse backgrounds and experiences, and we hope their story inspires and encourages you all, and that by highlighting these voices, we can continue to increase representation of all races, ethnicities, genders, and beliefs in surgery. So, Dr. Pereira, would you like to give a brief introduction? I know you have many accomplishments, but whatever you would like to mention is totally okay.
Oh no, hi everyone. I really appreciate the opportunity. Kat and Maria know that I'm struggling with Instagram, so I really apologize. I am an adult cardiac surgeon. I guess I've been in practice for almost 20 years now, which explains my Instagram deficiencies. But I come from a really, I guess, non-traditional background into surgery. And in the early days when I chose to go into surgery, there were really no women in surgery, let alone cardiac surgery. We're still really struggling at only 8% women. But my father and his family are all from Mexico, and he grew up on a farm, and English was his second language. And so I grew up speaking English and Spanish in Northern California, and really didn't appreciate until later in my years that we all need to talk about our non-traditional backgrounds and appreciate everything that we are and we have. And so one of my mid to late career real passions is promoting medical students into various surgical disciplines. And my father was always ashamed to speak English because his English was so broken. And as he got older in life, he really couldn't remember his English and speak his English. And I think just the experience of seeing him through his life and his career and everything that he did really drives me every day in my work. And happy to take any questions or, anything you guys want to talk about. Happy to chat about it.
Perfect. Yes. And so I'm just going to briefly mention that Dr. Sara Pereira is the professor of surgery at the University of Utah. She joined the CT division in 2020, and she serves as the program director for both the integrated and the traditional cardiothoracic surgery programs. And she's also the surgical director of the structural heart program at Utah. And she's also co-founder of the Latinos in Cardiothoracic Surgery group and the Latino Surgical Society and the Women in Surgeries group at the University of Utah. So we're happy to have you with us. We're going to start with just some couple of questions about you and like what drove you into pursuing surgery, especially like coming from your background, and what motivated you or made you want to pursue this career.
I am the first physician in my family, and my father never graduated from college. Honestly, he couldn't pass English, and kind of taught himself some engineering and worked as an engineer, shockingly, for many years. And he was amazing and brilliant. And then my mother had a math and business background, and she's German and English, so I have some very interesting roots. But she got really sick when I was in college and ended up having a liver transplant, and that kind of opened my eyes to the medical world. And she ended up getting an emergent kind of life-saving liver transplant when I was a freshman in college. And from that experience, I think it just motivated me to go into medicine. Once I was in medical school, I can honestly say that I tried everything possible not to pursue surgery. I think I try to be a nice person, and treat all of my patients like I wanted my mother to be treated, frankly. And I think that, we women always have this, it's kind of a double standard. And it's also that we're so darn hard on ourselves that we expect ourselves to do more and do better. And for me, it was really hard for me to accept the surgical life of trying to do everything. And so I tried to make myself a pediatrician, and I tried to make myself everything except for a surgeon. But ultimately, I just loved it and chose it. And so I guess I did general surgery first in Cincinnati, and then I went on to thoracic residency in Alabama.
And what motivated you to go into cardio and cardiothoracic?
I don't know. Maybe it was my ignorance at the time. I I just absolutely love the heart, and I had an undergrad in my case today, and I had a fourth year medical student and a fourth year surgery resident in my case today. So all kinds of levels, and I can honestly look at all three of them and say I just love the heart. Like, doing valves is fun, and the path has become much, much better. I wouldn't say that it's yet perfect for women, but I think that we have really great support groups. We have a great organization, Women in Thoracic Surgery, lots of scholarships available out there to go to our meetings. And, I think the field is just become a lot more diverse and a lot simpler to go into. And I just love the heart. So I think early on, I was kind of naive. I thought, oh, women can do anything. I can be a surgeon. Oh, I like the heart. Let me do it. But it was hard. I mean, I could say that 10 years of my career was very, very hard. And now I try my best every day to support junior faculty and students and residents to try to make the path easier for everyone else.
That's really great to hear that you've been trying to do that for everyone else, and even with the adversity that you were facing, I guess towards like the development of your career, which also leads into our next question that we wanted to ask you, are more specifically on what kinds of challenges and barriers that you faced along your journey to becoming a cardiothoracic surgeon.
I think the barriers in all fields are very similar, to be honest. I have friends in every specialty, and I think the barriers are similar for women. It's how to balance everything, how to do your job even better and get respect and take good care of your patients. But I do think depending on where you practice in surgery, happiness just depends on the culture. And I think that when you all choose residency programs, you have to choose your residency program based on the people you work with and how you feel like you will fit into those people that you work with. And I think it takes really great mentors, but it also takes a lot of instinct to know, who's going to support you, who's not going to support you. I've had some pretty unsupportive partners in my career, and it's made my life miserable. And then I've had some great supportive mentors and colleagues in my career that's made my life great. So I think that you have to just look for people who will support you. There are a lot of mentorship programs out there in all of the surgical disciplines through AWS and through, Latino Surgical Society and Society of Black Academic Surgeons. All of our great diverse groups have mentoring programs. And I would encourage everyone to find 3 or 4 mentors and keep in touch. And those are the people that will carry you through your career, honestly. And that's what's kept me in this work. But I think the barriers are still definitely there in surgery and cardiology. I was talking to a female cardiologist today, she feels them. And so it's all fields.
Mm-hmm. And how have you been able to overcome some of the barriers? I guess more so in your own personal experience, other than, I know that mentorship and organization involvement is very important for everyone, but do you have any specific examples of how that differed in your experience?
I think that you have to stick together. It took me many years to realize that, women have to stick together. You have to support each other. And through women in thoracic surgery, I've just made amazing friends, and we all talk about the same things. So I think being good at your job is one thing, right? I mean, I think doing a good job and taking care of your patients and operating is one thing. But something else is just having support, having somebody's ear and having somebody stick up for you at Morbidity and Mortality Conference. And those kind of things really make a huge difference, because if you don't have that on a day-to-day basis, then I think it's a lot harder to be happy in our specialties, all surgical specialties, honestly. I mean, if you ask the breast surgeons, they'll say the same thing. If you ask trauma surgeons, they'll say the same thing.
And do you have any specific examples from when you realized that representation in medicine, whether it be like your Mexican background or your like being a woman and having women stick together, have you found that that representation has like importance, or any examples when that has come up, that you're happy that you have that background in the surgical field?
Yeah, I mean, I think with diversity and representation comes great strength and power. And I think that, the ideas and different thought processes really helps all of us take care of our patients better. Here in Utah, we have a large Pacific Islander population. And, it's been really eye-opening to see all the challenges that Pacific Islander students face in Utah that's very similar from challenges that I faced or others face. And so I think that just keeping a real open mind and a really supportive mind to all groups is just so important in medicine. And it really helps us take care of our patients better, for one. But I think for two, for me personally, it makes me happier to sit in a boardroom that's not all Caucasian men. And I feel like all of us can relate on different levels and different backgrounds and bring diverse experiences. And it just makes the institution better for our patients as well. Specific example, I mean, I don't know, we put together like a climate survey for female surgeons at our institution, and we sent out, 80 surveys to all the female surgeons to kind of get like challenges and barriers and how is everybody's job satisfaction and burnout and all of those things, right? And our response rate was 71%. And one of the junior surgeons wanted to go present it at the surge exec board. And she's only a couple years out of practice. She's a different subspecialty than me. And I was like, no, I can't let you go there all alone to the surge exec board present this. And so, we went together, and it was what was expected. I mean, there was 90% males and one female at the table, and not a very diverse crowd at that particular table. And so I think it was just eye-opening for me to really see that. And not all of our boards are that way at my institution, but I think we just really together, because it would have been really hard on her to sit there alone and present all the data.
That's a great example.
Yeah. Yeah, I think women supporting women is always very important, and I think our organization is also proof of that.
Absolutely. I mean, it's for about 10 years in practice, I hid from all of our national meetings, and I hid from, participating in committees and all that. So hats off to you guys, because you're already doing it. But I think I was just, insecure and didn't know how it would help me. And I think that the support and the joy that I've gotten from the organizations I participate in has been huge. And I wish I would have done it in medical school and residency and early in my career, because I think it sets you a little bit higher and then lets you advance faster.
Were, were there any specific moments where you recalled that, you had that switch in the mentality of thinking that, now you're feeling a little bit more confident that you want to be more involved in these organizations? I know because you mentioned the first 10 years, like you were a little bit insecure and you didn't feel like you wanted to be involved, but were there any moments that specifically like changed your mind?
Yeah, I mean, I think all women feel insecure. So even women that you think are the presidents of the associations and doing like all these things you admire, like when they go up there and they're insecure. All women are. It's, you know, it's the imposter syndrome. It's like, can I really do this? Can that be me? And I think that it was in about 2015, and I looked at our specialty, and you know, I I was in private practice for 10 years, and we were having a really hard time hiring a junior surgeon into our practice that really had good surgical training. And this was a time when you couldn't pay people to go into cardiac surgery. Like there were one year there were 79 or 80 spots, and there were like 40 applications. And I just thought to myself, you know, if some of us don't step up and promote our specialty, then who's going to do it and who's going to train people? And so I really made the conscious decision to go back into education and academics, and went back to Alabama, which was where I trained, and we started an integrated training program. And I would say that in the years since, our specialties really turned the corner. You know, now the match rates are challenging, right? It's very competitive. And, um, you know, we get a match rate of 25% in our integrated programs and 60% in our traditional programs. And I think um, the light bulb went off when I was trying to interview a junior partner, and I just thought, how are we going to find someone well trained?
Mm-hmm.
Let alone a woman well trained, because nobody was going into it, right? So we
Mm.
just 462 women boarded in cardiac and thoracic surgery, and you can all imagine there's 4,000 men.
Mm-hmm.
So we have work to do.
Yes.
But
I'm sorry, what was
I
that?
said, but it's a great specialty, so I encourage you all to look into it.
Be the change you want to
Be
see.
the change.
Can you share any personal stories or patient experiences that deeply impacted you as a surgeon?
Oh my gosh, I've had so many, to be honest.
Sure.
In my office, I have like so many presents and things that patients have given me. But one of the disease processes that we take care of is aortic dissections, and those are probably our only true emergency in my field. And I've taken care of so many aortic dissection patients, and they range in age from 25 to 85. It's a big operation. It, you know, takes 6 hours, 8 hours, 10 hours. And people come from just walking down the street living a normal life to being just sick, you know, with probably a 50% mortality risk. And so I have a lot of dissection patients that I hold close to my heart, that I've sent back to their lives and their kids and their families. And I had one gentleman once that was, you know, just the rich and wealthy of Canada. He was president of one of the big Canadian banks. He had all the money he could ever have in the world, and he came to one of his family on a ski vacation and was skiing down the hill and had like the worst chest pain of his life and an aortic dissection. So we flew him in and took him to surgery, and it was one of the hardest operations I've ever done. But he survived. And after the operation and he got back to Canada, he invited my husband and I to his house up in Whistler that was just, I mean, amazing, right? And I don't normally kind of keep tabs with my patients on a personal note, but we were up there on vacation, so we stopped and had coffee with him. And it was just one of the most like eye-opening things, because the first thing he said to me was, you know, in my life I've had everything that I wanted, you know, like I'm very successful, I have a great family, you know, but this whole experience made me realize that, you know, money doesn't buy health. And it was just really kind of cool. And that was one of my favorite patient experiences on how, you know, hard work pays off. And I mean, I treat every single patient the same. It doesn't matter if they have insurance or don't have insurance or where they come from. I don't even look, you know. And So I think you'll all have those experiences in medicine where, you know, that you save somebody's life and that without you, they wouldn't be there and realize those things for their family, which is really
Yeah, it's really great to hear. I guess a little bit pivoting just slightly, since we are also holding this live in honor of Hispanic Heritage Month. I also wanted to get the chance to ask, how medical professionals and how, I guess, us students what can we do to contribute to improving healthcare access for Latinx individuals? Probably a
rewarding.
loaded question, but
Yeah, I mean, there's a lot we can all do, right? And I think we all have a lot of work to do. I think joining regional medical school groups is a start, like Latino Medical Student Association and SNMA. And, um, you know, with those groups, we hold volunteer events and things about kind of educating Latinx individuals, African American, Pacific Islander, I mean, different underrepresented groups. And I think that's a real start. Joining all of your local, and I should mention, like, LGBTQ communities need a lot of support. So I think all underrepresented groups need support, and through volunteer events and education in the community, high school pipeline projects I think are really important for bringing underrepresented folks into our careers to also help our patients. Um, in West Valley, Utah, where I am, we have kind of anti-racial groups and education support groups that we're able to go out to the community and like teach them how to do CPR, teach them how to use defibrillators. Those kind of projects are really fun to get involved in. Um, we have medical student surgery support groups that also put on events like that at schools. I'm all over the place with it because there's so much we can all do, but I do think that it's really important, and it makes us all realize that once we do join our medical careers, we're all privileged, right? And so I think giving back to our communities is really important.
And as far as like surgeons or medical professionals, when they have encounters with Latinx patients, what do you think they can do to like improve outcomes or to give them a better patient experience? Um, what would be your advice?
Yeah, yeah. I mean, fortunately in Utah, I'm so lucky because we actually have a really high Hispanic population. We're 24% Hispanic here in Salt Lake. And so every day I get really excited because I see at least, 2 to 3 Hispanic patients in my clinic. And I think, I mean, my Spanish isn't as good as other people's Spanish for sure, but I think that they really appreciate just seeing people that want to take care of them and understand them, and you know having people support them and be a voice for their healthcare. Help them get to the pharmacy, help them figure out the prescriptions on the bottles and write it out in Spanish. Um, I mean, my most grateful patients of all time have been my Latino and Latina patients. And, I think that's really rewarding to me personally. But I think also other underrepresented groups equally.
are there any certain unique challenges that you've had specifically with Latinx patients as a surgeon? And I guess it's similar along the lines of what you've been describing, but how do you ensure that you have effective communication and trust with them?
I think just sitting down and being an ear for patients is number one, no matter what their background. Patients just want you to listen and hear them. And I think the financial and insurance issues that folks from all communities have with healthcare and medicine is scary, right? So if one of my patients needs to have an operation, they have to not work for 4 to 6 weeks because of their external precautions. And so they worry about, how do I feed my kids? How do I support my family? What happens to my rent? And so I think offering things like talking to the financial people, just talking about how important it is to have their surgery done, how important it is to take their medications. Um, a lot of patients don't even understand that they really need to take their blood pressure medicines and how to take it, right? So offering like less expensive options for patients is really important. And then explaining to them why and how to take it in their native language is really important to them. So I think just little pieces that you can add to different ethnicities and races really helps you take care of your patients. And it makes them very loyal, I think, and grateful.
Yeah, I'm sure. For as far as advice for aspiring like Latinx applicants for residency programs, what advice would you give in terms of like, personal statements and mentorship?
Oh, it's a great question. It's application season. I think tell your story, right? Like any Latina woman applying to a surgery program, I think has an advantage. I mean, and this goes for everyone with unique backgrounds. So I don't, mean that I'm not going to go into any sort of affirmative action thing, but I think tell your story and be proud of your story because that's what makes you you. And so in the personal statement, I want it to read like a life story of where people came from, what interested them in surgery, um, and what you want to do with it. How do you want to help your patients? What kind of career do you envision? But I think those of us that come from non-traditional backgrounds, it's actually much easier to tell your story because you have a great story. And I think people don't realize that everybody really wants to hear that. And when you write your personal statement, you want people to read it and then at the end of it say, oh my gosh, I can't wait to meet them. And so I think that's really important. And I think it's really hard for many people to be proud of their story and where they came from. But I think that that is really, really important. So I do think that you have an advantage in the application season.
How do you what about like mentorship wise? Like what do you think about like reaching out to people and how to find mentors?
Yeah, I mean, I think the honest, sincere email is great. And if people don't answer, try again, right? I mean, we all get hundreds of emails a day. And I think if there's someone that you're really interested in that you hear is a good mentor, reach out. I'm not perfect, but honestly, I try to answer every single email of whoever emails me from all over the country. I have students and residents in every state almost. Um, I think reaching out helps. I think through the organizations helps. Like Society of Thoracic Surgery on their webpage has a request a mentor link, and people can go on there and request a mentor, and STS will match you with a mentor. Um, Through various scholarship programs, through all the societies, you can attend national meetings, and then they will match you with mentors. Um, And I think it's great to have local mentors and national mentors. I think both kinds of mentors help. Um, so I would start local and then go through the organizations.
That's great advice. I didn't even know that they had a find a mentor
Yeah,
button.
I
Um,
have a mentor connection here at my institution where medical students go on the web and they can request a mentor and they type in what they're interested in and then the medical school will match them with mentors. And so I
That's
that's
really great
great.
to
yeah,
hear.
Yeah.
I think probably all of your institutions have something like that, but that it's not necessarily known.
Oh, and I also wanted to say that we emailed you and we ended up in your spam folder and we still made it here.
That's
So,
great.
oh no, something happened with Kat.
Yeah, and I think, all faculty are busy, right? And so I wouldn't take it personally if you don't hear back. I would say, you know, email somebody with a sincere interest in a field and maybe a question and just say, I would appreciate the opportunity to talk. And then usually it leads to something else. And I've had students everywhere from high school to undergrad to medical school to residency. And if you ask around at your local schools about,
I am so sorry.
all right,
My internet glitched and I was like, oh my gosh,
having a
this
good
is
year.
great.
Yeah. All of you ask around at your schools about, who's good with mentoring students, and then you can look on the websites about things you're interested in and then just reach out. I think most faculty really stay on academic faculty to mentor and teach, and that's a reason we all stay at these programs.
Right. Um,
Um,
and then, yeah.
no, you go, you go.
Oh, we were just gonna ask. I know you mentioned the find a mentor through the Thoracic Society of Women Surgeons. Can you recommend any other resources or organizations supporting Latinx students interested in the surgical career? I think we talked about this a little, but I guess to reiterate.
I would definitely start with LMSA, which is an amazing organization, right? So there are a lot of Latino Medical Student Association chapters. I wouldn't say everywhere, but most. And then you can reach out to LMSA National too, kind of through the websites. I don't know yet if there's a link on their website, but I know there's a mentoring program because I've
Mhm.
had several mentees. And then Latino Surgical Society is an amazing organization, grassroots, started with 4 surgeons, and now I'll have to ask Dr. Romero how many members, but hugely supportive organization for Latino surgeons, and it's how I've met a lot of really great people in different specialties. I believe that American College of Surgeons, um, at American College of Surgeons, Latino Surgical has like a luncheon that they sponsor. It may be with Society of Black Academic Surgeons. Sometimes they do it together, but the purpose of those things at national organizations is for medical students to go. Honestly, I mean, I would not be shy. Um, we started with 2 amazing students, one from Hopkins, Emily Rodriguez, and one from University of Puerto Rico, Natalia Rowe. We started a very small group of Latinos in CT surgery, and we've been trying to meet at every national meeting. Um, and Angelica Martin, who's president at Davis, runs the social media page for that. And that's been great, just seeing the growth over a year of how many members. Um, I think Twitter is a great way, honestly. I know a lot of folks like Instagram, but Twitter is a great way to find out about what's going on. There are a lot of open houses and programs for all kinds of residency programs, and anyone can join. And so if you stay on Twitter and you're at a national meeting, it'll announce all of the events of like, hey, Latino Surgical is sponsoring a lunch, and then you should go, and that's the purpose of those, is just to help people network, meet people, really, really great opportunities that has been a big benefit of social media.
Absolutely. In the spirit of social media, anybody's in the audience as well, listening in or watching this live currently with this technical difficulty, Dory. If you guys have any questions, please put it out in the comments. We would really appreciate if you guys would participate and ask away. In the meanwhile, we can also keep the conversation going. I just wanted to put that plug out there.
I haven't figured out how to read this chat yet because I don't see any, but happy to
Mm.
answer questions, and feel free to reach out to anybody that you want to meet. You know, if you see somebody on a website, or if you see someone on Twitter that you want to meet, send them a message. I mean, I've met a lot of people that way. You can send people personal messages and say, hey, I'm a student at dot, dot, dot. I'm interested in this. It's a great opportunity.
I don't see any questions right now. Someone said, thank you for providing such an insightful presentation. I was going to ask you if when talking about like the personal statement and residency interviews, um, you said like make sure I want to meet you, like make it sound like I want to meet you. How do you stand out from like all these applicants, since there's like so many stories, and there's like in specifically like for integrated, there's only one spot available. So how do you come off as like I guess a one and only, or like very unique, I guess.
Well, I think we're all unique, right? So
Mm-hmm.
I think you'll be awesome, Maria. But I think what you do is, if you really know you want to do a certain specialty, you know, start now. It's never too early to start. So I have first and second year medical students that have reached out that then want to come to Utah and do a medical student rotation in their third or fourth year. And I think the more that people know you personally, the easier it is to get your number one program. Um, you know, integrated thoracic is a really small world, honestly. And even though there are so many applications, I would tell you that even before I get all the applications, I probably know like 95% of the Latina and women applicants that I've met. And we all talk. I mean, all of us talk like through our organizations, right? And so we all want to promote everybody's students. And so, you know, networking at meetings and through things like this is really important. And I think in the more competitive specialties, just start as soon as you think you know. And the more that people know your name, the easier it is to get your program. So don't be shy.
That's very good advice. I'll practice not being shy. We have a couple
Same.
of questions. Here is hi, Dr. Pereira, Karime. I don't know if I pronounced that right here. What advice do you have for doing into CT surgery, for going into CT surgery and academia? Academia? Thank you.
Well, I personally think that, especially when you're young in your career, I think that academia is a much more supportive environment. And I've lived both environments. I am not, a lot of people have the false impression that to stay in an academic practice, you have to be in a research lab, you know, 3 days a week and, you know, running a lab in addition to being a surgeon. And I think that academia also involves education and involves leadership and involves everything that everybody does on the side of their cases. And so, you know, my pillars for advancement in academia have always been education and then leadership stuff I do. It hasn't been how many papers I write and how many experiments I do. So I think also starting early with networking is really important. I do think that the research kind of stuff is really important in terms of getting into residency and promoting yourself to show that you've had, you know, the passion for the career. But as soon as you meet mentors who kind of know how to do it, they'll set you up with projects and, you know, introduce you to people at meetings. So I think advice is just networking and then starting early.
Another question is, what are some skills, hobbies that could be useful if you're interested in a surgical specialty?
Anything. Everybody needs hobbies.
Mm-hmm.
You have to have hobbies. in every single field of medicine, wellness is very important. Um, I mean, I have a lot of hobbies. I love mountain biking. I love my kids. I love my family. I love to travel and ski and everything, right? And that was part of my dilemma in choosing a surgical career is, how am I going to keep myself sane and half fit and keep biking and all that? And I think it takes a lot of calendar planning to make it to everything and do everything, but I definitely think it's doable. It's much more doable now in surgical careers than it was 20 years ago. And I think women are choosing to have children and families and all that much earlier. And you need hobbies. So everyone needs hobbies. Put that on your application. Do it. It's very important. Skills for surgery? I don't know. Practice?
Practice sewing.
Practice. Yeah.
Buy a suturing kit on Amazon.
Yeah.
I mean, I tried knots on my steering wheel like crazy when I was a medical student and a surgery resident. I remember like every time I came to a stoplight, I would just like throw knots, But yeah, I think it's just practice, you can get suturing things on Amazon, of course you can. And you can get a paper towel and you can practice sewing on it. One of our residents does that, our intern. It's hilarious. But surgery is all practice.
And I've actually heard from, I think that's a common question, and I've heard from residents that the real practice, like as if this is a medical student asking, is just like practicing understanding the room. Because when you do like OAs or when you're doing your surgery rotations, you're not gonna impress the surgeon by doing a suture. Like they probably see better suturing, but you're gonna impress them when you know what's next, or you know how to help prepare the patient or help the nurse or the tech. Would you say that that's true?
Absolutely. I mean, nobody expects medical students to know how to suture. I think what we look for in medical students is somebody that you can work with for 6 to 8 years. How do you like the students as people? How do they get along with everybody in the operating room? I mean, we had a student visit us last year that was an amazing student, but she always cursed in the operating room, like bad words, like during cases. And I think it was just, uh, they were so excited. Like they couldn't hold themselves back, But when we were sitting at a rank meeting, one of the faculty was just like, I just can't do it. I just can't do it. And so it was all about personality. And then we call it, emotional intelligence. Like, how can you read the room? How can you get along with staff and be appropriate during cases? Absolutely. And then I would say, just always volunteer to help when you're a student. That goes such a long way. Always volunteer to write a note or, go run an errand or take a patient to the lab or something. Those kind of little things actually really show that you're a team player. And that's kind of what everybody looks for.
Right. That's great advice.
Oh yeah.
Another question was, how do you recommend international medical graduates to improve their candidacy? I'm a U.S. citizen and attending school abroad.
Yeah, I think we do have a really tough situation in a lot of our specialties for international medical graduates. And particularly for the integrated programs, I think it is really tough. And the reason, honestly, is just because of the concerns about visas that I think programs worry that if they take an international medical grad into a 6 to 8 year program and there are visa issues, that they could potentially lose their resident. So that is a real issue. I think to make yourself stand out, it's really good to visit, to do rotations. And sadly, even though not so fair, I think that international medical grads have to do more research to kind of plump up their resumes a little bit more. But I think it's all about who you know and getting a foot in. Um, but I do think that the traditional independent thoracic surgery programs, for instance, are very friendly towards international medical grads. We have 50% in my program for our traditional program. And I think, doing general surgery first is a really good option instead of an integrated program.
Mm. Another question is, do you know if there are any interest support groups for pre-med undergrad at community college students? Is it too early during undergrad? Do you recommend anything we can do now during undergrad?
Yeah, I mean, in undergrad, I reached out to medical school programs about resources. So a lot of medical school programs have interest groups. There are summer programs for undergrads on improving your MCAT skills and summer research. Most medical schools have those kind of programs for undergrads. And then, I would say network. I mean, I had an undergrad in a case today that I had never met before, and he just sent me a very sincere letter about really wanting to see a heart operation. And I'm sure this young man's going to show up to my clinic many times in the next few years. And so I think, it just makes it easier when it comes to getting your letters and stuff.
Right, like networking. I think I remember in undergrad, I didn't specifically do this, but there was an honor society for pre-meds, and I think that's a great networking opportunity. So it's definitely not too early in undergrad. You have to start making the connections and like the right steps to going into medical school. So definitely reach out and network to whoever you can, maybe near you. It might be a little easier, but definitely outside of where you are too. I,
Yeah, I would say here at the clinics too. That's a
mhm.
way to meet people is, and medical schools love it, right? Volunteer at the county clinics downtown, and then you'll meet medical students and you'll meet mentors. And I was on the admissions committee for medical school for years. I don't do it anymore, but if you want to really check all the boxes, I would, volunteer at the clinics and really make yourself available for a lot of that. And it kind of pushes your application higher.
Yeah. Another question was, hello, Dr. Pereira. My last name is also Pereira. What advice do you have about approaching plastic surgery as a U.S. international medical graduate student, feeling like I shouldn't even apply to plastic programs as I am an IMG?
Yeah, I guess the answer to that is similar to the answer for integrated thoracic.
Mhm.
I do think it's harder depending on which visa you hold and how long the program is. Um, but I would network. I would try to meet people, go to a national plastics meeting and put yourself out there. And once you have a couple people in your court that I think it's much easier.
Right. The other question we had was a similar, what advice would you give an international medical graduate that has US experience, especially when trying to start an American residency program?
Get your foot in somehow.
Yeah.
Um, a lot of international medical grads will write like 55,000 emails, right? And the emails all read the same. And you want to personalize it. You don't want to send out like blanket emails to everyone. You want to try to personalize it. You know, you want to have someone proofread it. I mean, I receive a lot of emails from international medical grads, and if my name's not spelled correct, or if they call me like a man on the email, which happens a lot, um, I put that at the low priority. And so I think, you have to be sincere and you have to check the spelling, and then apply for some of the US organizational programs scholarships. That really helps. Like I would say women thoracic surgery scholarships. We sponsor a lot of international medical grads to come to our meetings. That's a good avenue.
That's all of our time.
Oh,
It's 7:59, so we made perfect timing. Um, Is there anything else that you wanted to say before we close up?
Well, I would like to say I really appreciate both of you hosting this and helping Instagram. And it's great to see the enthusiasm, not only for Hispanic Heritage Month, but also for the interest in surgery in general. So thank you for that.
Yeah,
Of
thank
course.
you
Thank you
for,
so much.
yeah, thank you so much, Dr. Pereira.
Great to see
Yes, thank you for talking to us and talking to everyone in our audience today. I'm sure they learned a lot from your experiences.
you. You're
And
welcome.
and this live will be on our Instagram account, so if anybody wants to go back for reference, it'll be there.
Awesome.
Mhm.
Thank
All
you.
right.
Have a great
Thank you.
Bye.
Bye.